Wellpoint Care Network, since its founding 170 years ago, has focused on the well-being of children, specifically children and families. So if someone is experiencing mental health challenge, or a family might be engaged with the child welfare system in our community, Wellpoint is here to help. So what we're striving to do as an organization is to connect to the community, to be community-facing in our commitment to serving, to being interested and engaged in the needs and the opinions of people in the community.
In order for healing to happen, it has to happen in everyday interactions. So that means our goal is to have all of the people in our communities, including the citizens themselves, our neighbors, have this information so that we are all part of the same healing journey.
Part of our mission is to help foster self-healing communities, and that means first acknowledge existence of disparity and discrimination within the community. After I acknowledge it, to ask ourselves, how do we become an advocate? How do we become continued allies and partnering with the community in order to help foster change.
Diversity, equity, and inclusion is so important to us because it relates to the people in our care. For them, they have to feel that we can understand and appreciate who they are, their hopes and dreams, their needs. One of the things that we've used to guide our diversity efforts over the last several years is the notion that when we came to someone's door to help provide support for them, we didn't look like them. And that was really difficult. Understanding the power of that translation into our workforce, our goals, our recruitment and retention has really helped advance our mission and helped the community see Wellpoint Care Network as a resource, a place where they might come for care rather than a place they are sent.
So within our role, I have the privilege of overseeing our contract with the Division of Milwaukee Child Protective Services. Within that contract, we have the responsibility for providing services to over 600 families and 1,100 children. We have the opportunity to contract with local minority-owned providers and essentially really kind of give back to the community. We recognize that a lot of the socioeconomic disparities that really impact the community at large rears its ugly head a lot of times in the lives of the families who come into our care. So we have an opportunity to promote what we call a self-healing community by giving back and making sure that we are working closely with some of the community-driven services.
One of the distinguishing things about Wellpoint Care Network is our commitment to trauma-informed care. For over a dozen years, we've been advancing the knowledge of neuroscience and early child development to help our community understand the impact of adversity when it occurs in childhood and working to create a network of support and healing for children and families.
And what falls under my purview is training and consulting, particularly to other sectors out there in our community around trauma-informed care, diversity, equity, inclusion, and helping other sectors on their journey of becoming trauma-informed. One of the things that we do through our training and consulting business is that we look at trauma-informed care and we understand that you cannot understand the impact of trauma without understanding the impact of historical trauma, systemic racism, oppression. So we really help people to understand the prevalence of adversity and that for many folks in our community, these other factors are underlying the challenges or struggles that they might be having.
We've been around a long time, and yet our energy, our passion for the future is as bright as it's ever been. Even though we're working our way through the pandemic, there's a commitment to the belief that restoring connections for kids and families is exactly what they need to thrive. That energy, their potential is what helps our community thrive. The future looks really bright.